The Mermaid in Pilates is a really great exercise for opening up the side of the body, finding lateral flexion through the ribs and also through the hip as well. You start by either sitting in a Z-sit position, so you'd have your leg in front and the other one down to the side. They can be in front of you, and both sitting bones want to be able to find the floor. If that's a little bit tricky at the moment, you can use a block or something like this, a bit more solid, and place it underneath the hip that's actually on the floor. And this allows the other sitting bone to drop off to one side, making you a little bit more level. So you can play around with that in your setup. But once you know your Mermaid setup, establish and find it, and then let's continue with the exercise. Placing your hand down to the side as a kickstand and reaching the other one up towards the ceiling. It might want to go back behind the head and let the head drop into the hand. That way you find your back line. And then this elbow wants to reach up towards the ceiling, opening through those ribs, fanning open and breathing into that side of the body. Now if you're mirroring me, this would be the left side of the body, the left ribs and the left lung that you're breathing into. With your right hand on the floor, your left arm could reach long and away. Inhale and exhale into that side of the body. You can keep it quite dynamic. You could inhale to center and exhale and soften through to the other side, fanning open through the ribs, the intercostals of the right side of the body. Inhale, center, and exhale. Inhale and exhale. Inhale and soften. Bow over in the wind, keeping the breastbone in line with the pelvis. Head nice and easy. We want to keep space between ear and shoulder, chin and chest, and ear and shoulder. This side dropping away, width through the front of the collarbones. Inhale and exhale. Maybe staying over on this side for a few breaths to feel it down a little bit deeper around that hip on the right hand side. And then inhale again and exhale and stay over on this side now, softening and reaching through those left fingertips. On an exhalation, we can add rotation. Shine your breastbone down towards the floor. Inhale and open up back to the front. Exhale to rotate. Inhale to open. Exhale to stay long. Inhale, center, and exhale. Then you want to switch your Z-sit. Again, if your Z-sit isn't comfortable, your legs can be out in front of you. You might prefer them crossed or anywhere that you can find yourself on your sitting bones. But if your Z-sit is okay, switch around to the other side. Again, if you're mirroring me, your left leg is going to be along the front of your mat and your right leg will be reaching now back behind you. Bring your left hand down onto the floor and reach the right arm up towards the ceiling. Reach through that side of the body and then soften, opening up through these ribs to help bow you over to the other side. Exhale. Inhale, center, and exhale to take it through to the other way. Checking in with how this QL feels, this quadratus lumborum on the left hand side, reaching through those fingers. Inhale, center, and exhale. So the body's already quite warm, it knows this choreography, so we don't have to do as many on this second side. But again, listen to your body, it may want a few more repetitions. Exhale and soften again, keeping space between ear and shoulders and collarbones wide. Inhale and then exhale, shine your breastbone down towards the floor, rotating in that thoracic spine through the ribs. Inhale to open. Exhale to soften and rotate. Inhale, exhale. Inhale, center. Exhale, and take it back through to the other side. And then finish. Do this exercise as much as you want. We don't move in our lateral flexion in daily life, so it's really great to open up the sides of the body, maybe to counteract where you find pain in a different plane of motion. So remember that side bending and often rotation or twisting are exactly what you need after you spend a lot of time in our sagittal plane, forwards and backwards in daily life.